Hey everyone, and welcome. Today we're diving into a different path to wellness, one called integrative medicine. It's all about looking at the big picture of your health by bringing together a holistic philosophy with the best of modern medical practices.
So let me ask you something right off the bat. What if healthcare was about more than just putting out fires? Treating symptoms. Imagine going to the doctor, and instead of just getting something to stop a cough, the real goal was to understand why you have that cough in the first place. That's the core idea we're digging into today.
So first up, let's talk about the big idea here, a holistic approach to health. This is a total shift in perspective, right? We're moving away from just fixing one specific problem and instead looking at caring for the entire person. And the philosophy really starts with this concept. It's a healing-oriented approach. So what does that actually mean? Well, it means the goal isn't just to suppress symptoms. Nope. It's about fostering genuine well-being by considering you as a whole person.
And this part is absolutely key. It is not about choosing between conventional medicine and other therapies. It's about combining the best of both worlds. Think of it like this. Why would you only use a hammer when you could have a whole toolbox? You get a much more complete and powerful way to approach your health.
Okay, so we get the big idea, but what does integrative medicine actually mean? Let's get a really clear definition. This definition really hits on two crucial points. First, a partnership with your doctor, and second, a focus on the root causes. So instead of just getting a pill for those recurring headaches, this approach asks why they're happening. Is it stress, diet, something else entirely? It's kind of like medical detective work. So when we say the whole person, what are we really talking about? Well, it's these four pillars. And we all kind of know intuitively that they're connected, right? You have a crazy stressful week at work, that's mental and emotional, and next thing you know, you've got a killer tension headache, which is physical. This approach just takes that connection seriously.
Okay, so that's the theory. But how does this all actually work in a doctor's office? Let's take a look at what the process is like when you go from theory to therapy.
The patient journey really comes down to two key things. First, your plan is personalized. This is not a one-size-fits-all approach. And second, that plan draws from a whole range of different therapies so the treatment can be tailored perfectly to your specific needs. And that diverse toolbox is so important. It means a practitioner can combine standard internal medicine with something like nutritional counseling to address diet, or maybe use body-based therapies like acupuncture for pain management. It's all about using whichever combination of tools is right for the job. So what's the real driving force behind this approach? Let's dig into the core philosophy, the why behind it all. At its absolute heart, this is all about patient-centered care. This really flips the script. You're not just passively receiving a treatment plan. You're an active partner, working with your practitioner to navigate your health journey together. Of course, any strong partnership needs an expert guide. The practitioner's role isn't just to prescribe things, but really to act as a knowledgeable coach on your path to wellness. And this quote just sums up the entire philosophy perfectly. It's a commitment to addressing the whole person, not just the disease, because you are so much more than a label or a list of symptoms. So what's the ultimate goal of all this? It's to achieve something called stable homeostasis, which is just a scientific term for the body's ideal internal balance. Think of it as your body's natural state of harmony where everything is just working like it should. That's the target. So let's bring this all back home. What does all of this actually mean for your personal path to health? Okay, so what are the big takeaways? It's an approach that looks for root causes, not just symptoms. It treats you as a whole person, makes you a partner in your own care, and it combines the best of conventional and complementary medicine. It's really about a smarter, more complete view of health. Which leaves us with one final question to think about. Seeing your health through this holistic lens, what could be your first step, big or small, towards achieving that optimal balance for yourself?